Liposuction of the knees, thighs, saddlebags, essentially liposuction of anywhere on the thighs is done to improve the contour of the thighs. So there are often stubborn areas of fat on thighs that will not go away with any amount of diet or exercise, and liposuction is a good treatment option to remove those areas of unwanted fat. Sometimes we need to suck out fat from the inside of the knee. Sometimes we need to remove fat from the medial thigh. Sometimes we need to remove fat from the lateral thigh. Sometimes we even need to add fat to the buttock or hips to improve the overall contour. So that is what liposuction does, is it removes unwanted areas of excess subcutaneous fat of the thighs to improve the overall contour. Now, one of the limitations of liposuction to the thighs is that it does not tighten up the skin, meaning the only thing liposuction treats is the extra subcutaneous fat. So if we remove too much extra subcutaneous fat and you have too much extra skin, that loose skin will become even worse or more noticeable because we've decreased the amount of fat underneath it. So if you have extra skin, you may need a thigh lift, such as a thigh-plasty, and I discussed that in a different video. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.